IQWealth.com. That's IQWealth.com. I'm Ron Tanner.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. Indeed it is. It is Friday, September the 28th, the last Friday of September, as we get ready to launch into the fourth quarter of 2018. My, oh my, where does the time go? Well, we got a lot to cover today, and I just want to say to our listening audience, if this is your first time hearing our show is Health Futures, and the reason why we've named it that is it is about how our older adult population can live a healthier, happier life. And we really look to the future because we look at the changes that are happening not only in innovation and tech, but the demographic changes. I mean, they are happening before us. You know, we've heard for years about the silver tsunami, that this thing is coming. Well, guess what? It's here. And we're starting to see the effects of this silver tsunami. So if you are listening here for the first time, the way we convey this show and the way we deliver to you, our listening audience, is bringing extraordinary guests to the show. And today is no different. I have an extraordinary guest here on the show, a guest that was here in January 2017, was actually on the 20th during the inauguration of our current president, President Donald Trump. And I want to welcome to the show Scott Hawthornthwaite. He is the Care Coordination Director of the Area Agency on Aging Region 1. Welcome to the show, Scott.
Thanks for having me, Bob.
You know, the Area Agency does so much in our community, and we're going to talk a lot about it here on the show. But there are a lot of messages that we want to impart to you, our listening audience. And if it is you that is over 65, or you are an adult child, or you are a loved one of somebody that is an older adult, listen here for the next 50 to 55 minutes, because we're going to give you a lot of good information. To start, open enrollment. What's going on with open enrollment? Talk to our listening audience. We're talking about Medicare open enrollment.
We are, Bob. Every fall, Medicare offers an open enrollment period. It's from October 15th through December 7th. And you'll notice starting next week, if you're an older adult or caring for one, a lot of materials showing up in your mailbox. Many companies, of course, see this as a marketing opportunity. It's the one time during the year that you're able to change plans and options within Medicare. Perhaps Medicare Advantage. People also have questions about SSI and Arizona long-term care or whatever about benefits. It's important to know about our Benefits Assistance Program. It's part of the SHIP program, which is a national program. But most importantly, I want people to know that these are folks who are not funded by any insurance company. They don't choose a plan for you. It's for you to make the option based on informed information. So we do that many ways. We have counselors who are trained by Medicare. Of course, there is no cost. People can either call and speak to a counselor on the phone. Sometimes they can make an appointment and come in and meet with a counselor. Or the very cool thing is there are sites located throughout Maricopa County where you can make an appointment and meet with a trained counselor. That way you can bring your papers or whatever you need. And they're everywhere from Buckeye to Chandler to Fountain Hills to Gila Bend. There's a place where you can meet with a trained professional to look at your options and see what's best for you.
And if you don't know this, Area Agency on Aging has a very robust website, and it's really easy to get to. It's PHX for Phoenix. Again, it's phx.org. Or call them at 602-264-4357.
Right.
And you guys do so much. And right now, we're just talking about an open enrollment. And,
right.
and if you miss an open enrollment, you miss for the entire year.
For the entire year, yes.
So one of the things I did want to ask you, Scott, is that if you're not 65, but you're going to turn 65, because I know it's a little tricky here, because you could be 64 and go through open enrollment, right? Because
yes.
you're going to turn 65 in 2019.
That's correct. And also people for planning, just to get educated. What is Medicare Part D? How does that work with other benefits I might have? Maybe I need a Medicare Advantage plan or just info on a supplement. But yes, you're right. In fact, planning ahead is always a good move if you're able to.
It is. And I also want to make this appeal, and you brought it up before we even started the show. You know, when you get this packet, it's pretty daunting. I mean, it's huge. And, you know, it's our government, and we don't make anything really easy. Right. So, you know, this appeal really is to caregivers, too, family
it's
caregivers.
To caregivers as well. In fact, we were talking, if I hadn't been in the business, and I have folks who are on Medicare, I wouldn't really know how to discuss it with them or
right.
know what's a Part D or a Medicare Advantage. Why would I if I didn't deal with that as a caregiver or in the field? So please, we're also reaching out to family caregivers so that you can get the information to help yourself and your loved one make an informed decision. There's many people out there offering assistance with Medicare. There's 800 numbers going on, but they're actually funded through insurance companies. And although they're fine folks, they're going to steer you to the one that makes them a profit. We have all of the info on all of the plans, and it's to have you make the choice that's best for you.
So I know we're going to visit this because it's really important, but I want to reiterate, Area Agency on Aging is not an insurance plan. It is. I liken you guys being navigators. You're helping to navigate to the best solution for whatever your challenge that you're dealing with.
That's correct.
And you have no biases, but you'll let them know. Your counselors, the people on the other line, social workers will walk them through what some of those solutions are. So again, AAAPHX.org or call 602-264-4357.
Right. That's our 24-hour senior helpline.
So last week, on Thursday and Friday, you guys had your Aging Well in Arizona conference. It was down there at Wrigleyville West. And first of all, I mean, I've lived here not as long as you have, but I've coming up on 24, 25 years. And what they've done to that area is amazing. It is amazing. It really is.
And if you're a Cubs fan, it's even more amazing. The stadium's right next to the hotel. Yes.
The stadium's right next. But I'm going to tell you, that place was buzzing. Yeah. It really was. And if you could give just our listening audience just an executive summary of what the goal was about aging well in Arizona and this conference.
I would. This was a unique conference because it was for all of the area agencies on aging in Arizona, all 8 of them, for us to come together. So not only was it informative to the public, it was good for us to see our peers in other areas who are dealing with the same programs but in different rural and different areas. A lot of the Aging Summit was around resiliency in aging. Mm-hmm. We had several examples of people who have come here as a refugee from another country, people who had gone through very trying experiences. We had a survivor of the Holocaust and Japanese internment, and really their message was about forgiveness, about resiliency, about not letting things that were horrible in the past affect all of your life. And I found that very powerful.
I found it powerful, too. And I actually attended my guest earlier this month, his presentation. That's Dr. Babak Nairi.
Yes.
And as you know, he is with the Department of Health Services. And in that same vein, aging well, healthy living for older adults. And, the thing that he shared with us, the audience there, was this statistics. And the numbers are just crazy here in our state. Our state has, our demographics are much greater as it relates to aging and older adults than in any other place in the country. And when you look at Alzheimer's,
yes,
6th leading cause of death nationally, but it's the 4th leading cause here. So
yes,
he gave some great information about how to live healthy and age well. Yes. So you know what, Scott? Hearing a little bit of music taking us out here. Was this one that you requested?
It was.
This is really good. So we got a little bit of time before we say goodbye to our first segment. I want to tee up the second segment. I think, you're in that vertical that is really more care coordination, and I really want to talk a little bit about the caregiver support initiatives that you guys have.
Very good.
Because we talk about caregiving a lot here. Good. So in our second segment, I really want to talk about the support and the fact that if you are a family caregiver, you don't have to do this alone.
You don't have to do it alone. And there is a name for what you do. You are a family caregiver, the backbone of the long-term care
I love
system.
You've been listening to Health Futures Taking Stock in You. I got Scott Hawthornthwaite from the Area Agency on Aging. We will be right back.
See, here I am on the road again. There I am.
Bill Gunderson's Nationwide Best Stocks radio show is now on Money Radio 1510 AM and 105.3 FM. Every morning from 9 to 10 a.m., professional money manager Bill Gunderson will talk about the economy, markets, and the best stocks now. Bill Gunderson is also the inventor of the Best Stocks Now app and the writer of the weekly Best Stocks Now newsletter. If you like to invest in the markets, this is the show for you. You will not want to miss one episode. Visit GundersonCapital.com for more info. That's GundersonCapital.com.
Are you in the market for a new home? Before you even call a realtor, the first call you should make is to the Lund Mortgage Team to get pre-approved for a loan in just minutes. This way you know exactly what to tell your realtor you are looking for and the budget you have for your new home. Hey everybody, Mark Asher to remind you about keeping it local. As many of you know, I was born and raised in Arizona, so when I see great companies who are all about the Valley, people who grow up in the same area and call the same area I live in home, it makes me proud. It makes me want to use that company. The Lund Mortgage Team is just that. They have been in the Valley for decades and have built their name on trust, honesty, and the true meaning of hard work. They are available nights, weekends, or whenever is convenient for your family to meet. They offer the lowest rates and the lowest fees as well. It's all about you when working with the Lund Mortgage Team. So call today, 623-875-9940. You can also get pre-approved online at LundMortgageTeam.com. Call today, 623-875-9940.
The following update is for drivers who pay too much for car insurance due to DUIs, DWIs, tickets, or anything else. Our company specializes in low-cost SR22 auto insurance. We know that mistakes happen and offer free quotes for very affordable auto insurance meant specifically for you, the overpaying high-risk driver. The quote is free, and we'll handle the filing so you can start saving money. Call 800-749-2984, 800-749-2984, 800-749-2984.
The next generation of home improvement with everything you need to do, projects smarter. The Home Depot. More saving, more doing.
But the pains to the rose, some stranger to you and me.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You, and it's a Phil Collins Friday. I love that. It reminds me a little bit of the 80s, so thank you, Wes, for giving us a little bit of Phil Collins. Bringing us into the second segment, if you're just tuning in, I've got Scott Hawthornthwaite. He is the Care Coordination Director over Area Agency on Aging, Region 1. And, we jumped into a lot of stuff in the first segment. We talked a little bit about aging well in Arizona and what that really was. We talked about Medicare and enrollment is coming up. But we really didn't talk about what is Area Agency on Aging. And, Scott, for our listening audience, I want them to really understand what it is, because it's not just an Arizona thing. It's not just a Phoenix thing. What is Area Agency on Aging?
Good. Thanks, Bob. Area Agencies on Aging are nonprofits. They were developed through the Older Americans Act of 1965, and in 1973 it was reauthorized to include area agencies on aging. There is one in every community in the United States. We're the one for Maricopa County, one of 8 in Arizona, one of over 622 nationally. So everyone... 622 area agencies. Everyone is covered under an area agency, all states and territories, including Guam and Puerto Rico. There's an area agency on aging. And we are set up to receive federal and state funding to do planning and also to serve seniors and those who care for them in the community. But we are all nonprofits. And like I said, we are Region 1 in Maricopa County. If you're listening and you're concerned about an older person in another state, you can contact us and we'll put you in touch with the intake number of an area agency for your loved one anywhere in the United States.
That's great. And especially when you sit here in Arizona, we know so many people come here, and they come here because of the quality of the weather and their life, and maybe it's a job, but they've left loved ones back in other places. So it's really nice to know, and for our listening audience to know that there are these resources.
Yes. Each area agency is a little bit different, but all offer the same core services.
So we teed up at the end of the second segment. We talked about the family caregivers and the caregiver support groups. Family caregiving is the backbone of our nation. The fact that these folks give up their lives like they do, it is such a noble profession, and such it is. They're the heroes. Yes. They make the ultimate sacrifice, and I have such admiration and respect. And before we get into some of the support programs, I've made this appeal often here. If you know of someone that's doing family caregiving, offer to lend support, and if they don't accept your offer, then just do. I always use the example: if you're cooking a casserole, make 2. And then just deliver it to your neighbor, your friend or family member that's doing caregiving. Say, look, I made you dinner. The crazy thing is, Scott, and I think a lot of it is this greatest generation that we are caring for right now. They really took the oath of sickness and health literally, and for their spouses, they are really feeling like it's their job and it's their responsibility, and they don't want to accept any help.
And that's part of our issue. One of our biggest 2 issues in caregiving is self-identification. People don't think we're talking about them. When we ask a gentleman to come to our support group because his wife's attending an adult day health care, he's likely to say, I'm not a caregiver, that's my wife. So we have issues when people feel it's a responsibility. They often don't relate to that word. So that's our job, to tweak the message. Maybe we need to say, are you caring for an older adult? Let's talk. Right. Because half the people don't think we're talking about them as a family caregiver. People will say, I go across town, I do the shopping, I mow the grass, I take them to the doctor, but I'm not a caregiver.
I think you are.
You are a caregiver. Right.
Whether you know it or not, you are.
Right. That and denial of help.
Right.
People that are obviously stressed, but they say, I've got it. I've got it covered, and I don't have time for a support group.
Exactly.
So those are the 2 things that we're talking about you, and let's make some time for you so you can continue to be an awesome caregiver.
And I would imagine that we have some people listening right now that are caregivers.
I'm sure.
And they don't self-identify.
That's right.
So, just take to heart some of the things that Scott just said.
Yes, please.
And seriously, consider getting some respite, some support. And that's stuff that Cypress does, and that's stuff that Area Agency on Aging can direct you to.
Yes.
Those types of resources.
Yes. You had given out the number of our senior helpline. That's how referrals come in for almost all of our programs. And you don't have to remember all the names of the programs or any acronyms we speak of. You can call in and tell the professional your situation, and they'll guide you to the appropriate program.
Yeah, you've got an incredible staff there. And they are, navigators, guiders, whatever you want to call them. They will direct you to what that solution is that you're needing and looking for.
That's correct. The senior helpline are all master's level, mostly social workers, and half are bilingual English-Spanish, and we take calls 24 hours a day.
I love it. So let's talk a little bit about some of the support groups that you guys have.
Sure. Under the Family Caregiver Support Program, there are 4 different things that we provide for caregivers, and one of them is support or peer counseling. We have several groups throughout the county that we pay the professional facilitator, but there are also many other groups as well, aside from ours. But we do have groups. The highest attended groups tend to be the disease-specific ones, such as Alzheimer's and Parkinson's. We do have some in Spanish. We have some that are unique for men who some of their issues might be a little bit different. But we do offer support at different hours throughout the day. There are also some online support groups that people can plug into if they're unable to go to a traditional group. But caregivers who do go to groups report better coping skills, better understanding about what's happening, and also to make some friends. We have a group that met for many years, and over the time their loved ones were either placed or passed away, and they continued to meet, these 6 ladies at a Denny's every other Saturday for many times because they had bonded. They had something in common, and they still continue to provide support because we know, as even if you have to place your loved one, you're still a caregiver. Your role may have changed, but there's still caregiving.
Right.
So that support even continues into friendships in many cases. If people go to a group and they don't like it, and sometimes people have told us maybe it was an off night, maybe there was someone in crisis who was dominating the group, please try it again. Every group's a little bit different, or find another one that's more suitable for you.
I think more than anything, it helps people realize they're not alone.
That's exactly it. People think they're unique.
Yeah.
Maybe they've had some thoughts that they've never told another person about caregiving. It's powerful to hear another person tell your story.
And if you're a little uncertain whether or not to go, you don't have to speak. Just go and listen.
That's right. You can be anonymous.
Yeah.
You can speak if you want to. Just pick up some tools, some ideas. Many caregivers learn just from discussing how to deal with certain issues with the other people in the group. No, I think that's excellent. All of the groups are free. If you are having trouble finding a group, we'll help you find one. There's a group for almost everything out there you can imagine, not just caregiving, but pretty much anything out there. There's a support group. So get in touch with us for that. One of the things we deal with sometimes is with bereavement. And I know bereavement or death of spouse can cause a lot of social isolation. There are wonderful groups in the community dealing with bereavement. All of the hospices provide them. They will let people attend, of course, even if if their loved one wasn't involved in hospice. But I think it's really important, especially when your traditional role as a caregiver has changed, to also be in a group where people understand. And
you mentioned that hospices do provide them, and
yes.
I've had the privilege of having Hospice of the Valley here on the show multiple
yes.
times. I had Susan Levine multiple times, and I've had Lynn Cooney here. And these hospices, and especially Hospice of the Valley, they'll stay with you as it relates to bereavement for up to 1 year.
Yeah.
And they'll also, they do it for children too,
yes.
and children have a hard time coping with that.
Yes.
You teed up something that I want to talk about in the third segment is social isolation. I really think that we don't give enough attention to that, and I want to talk about that. But one thing I want to talk about as we exit the family caregivers is Duet, Partners in Healthy Aging. I'm on their board of directors, and they host annually, this is their third one, a caregiver symposium. And it's coming up on October 18th, and it is located at it's going to be at the First Christian Church of Phoenix over at 6750 North 7th Avenue. And it's $20 for family caregiver, $40 per professionals. It's from 9 a.m. to 1:30. If you are a family caregiver, you need to go with this thing. This thing is awesome. It's awesome. Not only the programming, but many different agencies are there with their materials, and we take the time. We have the time at this venue to talk to you and one of my previous guests is Pierre Theriault. Dr. Theriault from Banner Alzheimer's Institute is going to be there as well. Perfect. We're up here at halftime at Health Futures. You've been listening to Scott Hawthornthwaite. He is with Area Agency on Aging, and me, your host, Bob Roth. Stick around for the second half. We got a lot more to cover. We'll be right back.
As we reach the bottom of the hour, we pause for a look at the world's news. Then we're back with Money Talk. We're Money Radio 1510 AM and 105.3 FM.
Special report Kavanaugh committee vote.
The vote was a positive vote, but there seems to be a delay.
President Trump's first reaction after the Senate Judiciary Committee voted to advance to the full Senate the nomination of Brett Kavanaugh. The vote came after Senator Jeff Flake demanded a one-week investigation of sexual assault charges against the Supreme Court nominee. Flake may have been moved by an encounter with a protester.
Look at me when I'm talking to you. You're telling me that my assault doesn't matter. That what happened to me doesn't matter, and that you're going to let people who do these things into power.
Senator Chris Coons applauded the last-minute move by Flake.
I'm deeply grateful to Senator Flake and others who I believe will join him in saying that they are not comfortable proceeding to a final vote on Judge Kavanaugh's nomination without a short, additional professional period of investigation.
Kavanaugh's friend Mark Judge says he'll cooperate with investigators, but only confidentially. I'm Mike Moss.
Noted author, former chief medical correspondent, and Salonpas user Dr. Bob Arnott.
The human body has billions of pain receptors. Block those receptors with the anesthetics found in Salonpas Lidocaine Plus, and you'll have relief. Salonpas Lidocaine Plus contains 2 anesthetics, including the maximum strength lidocaine available without a prescription. They numb aggravated nerves for effective, lasting relief. For relief, try what I use, Salonpas Lidocaine Plus.
In the silver box with the blue wave.
If you or someone you know is struggling with addiction, please call this toll-free number right now. 800-390-9528. That's 800-390-9528. By calling your addiction team, you're taking the first steps to recovery. The help you need could be one call away. 800-390-9528. Make the free call now. 800-390-9528. Your addiction team is a third-party advertiser for various treatment centers and placement networks. Individual results will vary. Visit youraddictionteam.com/terms for more information.
Retirement. Are you near it or already in it? Well, this place, Money Radio, is a place to stay to make sure it all works out the way you want. We're all about money right here.
Join certified financial planner Nancy Fleming this and every Wednesday afternoon as she joins me for Financial Review. Nancy and I discuss an array of topics from Social Security, taxes, to what types of obstacles you can and will face in retirement. So join Nancy every Wednesday afternoon at 4:35 for the Financial Review. Want more, Nancy? Be sure to tune in every Saturday morning at 10 a.m. for My Smart Retirement, right here on Money Radio.
Hey everybody, Mark Asher here with a story I think you all love and respect. You know, many times we hear about fathers turning the family business over to their sons, but it's not every day we hear about the daughters who end up running the family business. We are lucky here in the Valley as we have that very story with the Lund Mortgage Team. Let me introduce you to my friend, the CEO of the Lund Mortgage Team, Lisa Lund.
Hi, Mark.
Hey, Lisa, your dad, Stan, was one of the best in the mortgage business and started the company when you were just a young girl. How proud are you today to own the Lund Mortgage Team?
I'm extremely proud and honored. I was able to work with my father side by side for 16 years before he unfortunately passed away in 2014. In that time, he taught me how to run a business with honesty and integrity. My dad believed in handshakes, face-to-face interaction, and most importantly, putting the client first. Today, the Lund Mortgage Team continues to carry on this personal touch. My family would love to help your family with any of your mortgage needs.
Family owned and operated. Call the Lund Mortgage Team today, 623-875-9940.
The following update is for drivers who pay too much for car insurance due to DUIs, DWIs, tickets, or anything else. Our company specializes in low-cost SR22 auto insurance. We know that mistakes happen and offer free quotes for very affordable auto insurance meant specifically for you, the overpaying high-risk driver. The quote is free, and we'll handle the filing so you can start saving money. Call 800-749-2984, 800-749-2984, 800-749-2984.
The next generation of home improvement with everything you need to do, projects smarter. The Home Depot. More saving, more doing.
Chesko with Your Money Now. If you were automatically logged out of your Facebook account this morning, it's because you might have been affected by a security breach. Facebook says a hacker this week put the data of some 50 million users at risk, and so it required those account holders to log back in. Facebook said the vulnerability has been fixed and that law enforcement has been notified. Chief Executive Mark Zuckerberg said the issue was discovered Tuesday, and he admitted that Facebook still needs better safeguards to avoid breaches. Stocks are slightly lower now. The Dow Industrial's down 11 points, the Nasdaq flat, S&P down a point. He's been dead nearly 2 years, but there'll be a new album from Leonard Cohen next year. The son of the critically acclaimed Canadian singer-songwriter told the CBC that he's been working on an unfinished collection of songs by his father, best known for 1984's Hallelujah. Oil futures surged today on signs of tighter global supplies. November crude jumped $1.13 to settle at $73.25 a barrel. That's Your Money Now.
The clock is ticking.
Every day you put off buying life insurance can cost you big time. The older you get, the more you'll have to pay. And a sudden accident or unexpected illness could cause your rates to skyrocket or even make you uninsurable. Beat the clock. Call Select Quote now. No hassle, no obligation. In minutes, you'll have a choice of your best rates from up to 10 highly rated life insurance companies. Richard, 40 years old, takes meds to control his cholesterol. Still, Select Quote got him a 10-year, $500,000 policy for under $25 a month. Under $1 a day. Don't risk your family's security another minute. Get your free quote now. Just call 800-569-2121. That's 800-569-2121. 800-569-2121. Or go to SelectQuote.com. Since 1985, we shop, you save.
Get full details on the example policy at SelectQuote.com/commercials. Or price could vary depending on your health, issuing company, and other factors. Not available in all states.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, we're on our third segment. I got Scott Hawthornthwaite from the Area Agency on Aging. He's the Care Coordinator Director, and we've talked about a lot of really good stuff. And if you missed it, go out to our website at cypresshomecare.com. Up across the top, you'll see a media button. Click on that. The third button down is radio show. You'll be able to catch our first 2 segments, and you'll be able to catch the rest of these and about 200 other shows, including the one I had with Scott back on January 20th, 2017. So, Scott, we were talking about the family caregiver. We were talking about family caregiver support. We were talking about respite at the end of our third segment.
Right.
I want to pick up on that, and then I want to talk about a little bit about social isolation.
Sure. If you're a family caregiver or you know someone else who's caring for an older loved one, please call the Area Agency on Aging. We'll direct you to a case manager who works your neighborhood, who will schedule a time that's good for you to come out at no cost, do an assessment of your situation, and develop a care plan. It may include our services, or it may include private pay or something else that would be more appropriate for you. But again, there's never a fee for the assessment. Have a social worker come out and meet with you and your loved one and come up with a plan that meets your situation. Every caregiving situation is a little bit different, so the plan we determine has to be flexible and take that into account. Most people who call us are looking for respite care, a brief timeout or interval of rest. If you're a caregiver 24/7, it can take a toll on you. We see people who haven't left the house in a few months, haven't even been able to do their own well checkup, medical and dental checkups. They want to continue to be a caregiver, but in order to continue to be an awesome caregiver, they need to take some time for themselves.
They do. And, you know, it's interesting because I've given this fact before, and it's a data fact that we get from both AARP, and it's also something that, you know, was published in the Journal of American Medical Association through the University of Pittsburgh, and that is caregivers themselves are at a 63% higher risk of mortality than non-caregivers. And I'm talking about caregivers these are the ones that are 65 and older that are caring for a loved one, and their loved one, or should I say they predeceased their loved one that they're caring for 63% of the time. So that's why they need respite. They need care. We need to look out for them.
That's right. Whether it be stress, lack of sleep, or even not going to your own medical checkups. It's true. Your health
All
is
the
at
above.
risk. Yes.
All the above. They do it all because
Yes.
they sacrifice everything for the ones they love.
So for people who need some respite, just a brief opportunity to do whatever it is that recharges your batteries. We don't put much stock in what the caregiver wants to do. Some want to take a nap or walk around the mall, whatever it is that gives you that break, then that's what we support. And we do respite 3 different ways. One is through our contracted home care agencies, where we send a trained fingerprint cleared, trained professional out to the home, typically 2 4-hour shifts per week. We're not taking the place of a caregiver. We're just releasing a little bit of that pressure so you have some time for yourself. And that is scheduled. You might think, well, how will I know when I would be stressed? But it's for that organized caregiver who knows that, for example, every Saturday morning and Tuesday afternoon, that's my time. If someone calls me and says, let's go to lunch, that's when I'm going to do it. That's when I'll make my medical appointment. I know who's coming. I know when they're going to be there. The time is prescribed. That works very well for caregivers. In that model, there is a copay assigned, but based on the care receiver's income, not the family caregiver. It's typically $1, $2, or $3 per hour. If there is one, most clients' income, there is not a copay. If that's the barrier, we'll waive it and take a look at that later. The second way is the same in-home respite, the same 8 hours per week, but it's called Friends and Neighbors, a consumer-directed model. This is a model where you, the caregiver, chooses the person who will be providing respite. You pay them. Of course, we need receipts and timesheets to be sent in, and then we reimburse you, the caregiver. This works particularly well with care receivers who have a dementia diagnosis or have some confusion. Maybe it's just not going to work to have a new person come into the home. Perhaps you have a friend or a neighbor that's already known to your care receiver who can come over and spend some time with your loved one, and that can be your respite. It also works well in rural areas where it's difficult to get the traditional agency model to go out to the rural parts of Maricopa County, like Gila Bend and Wickenburg. And it also works well for people who need a non-traditional schedule. I was working with a caregiver the other day who has young children and is caring for her elderly mom. She has the neighbor come over an hour and a half every morning during the week to be with her mom while she's able to get her kids ready and off to school. So you have much more control of the schedule. It's not for everybody. Some would rather have someone that they don't know be the respite worker. Some aren't comfortable with doing the timesheets and the receipts and what have you. But it works well when there's a non-English speaking person. We have some families from other countries where it makes better sense to hire somebody from their community to be the respite worker. And then thirdly, we have adult day health care as respite. We contract with 14 adult day health cares throughout Maricopa County. And an adult day health care is similar to a senior center. It's in the community, recreation, noontime meal. But an adult day care is for someone who's moved along the continuum, still needs the recreation and socialization and noontime meal, but needs a secure setting where there's an RN and CNAs available. And that's a very good model for respite. It not only gives the family caregiver that break, it gives the care receiver a chance to get out, be a part of a center, meet some new friends, have something to share at the end of the day, what they did with their day. And with that model, we're able to authorize 2 days a week. It includes transportation. They'll bathe your loved one at the center.
Nice. The
thing we find with adult daycare is sometimes people don't want to go. It kind of makes sense. But once they go, over half call to say, can I go more often? It's just a matter of going.
Right.
You can contact us. We'll put you in touch with the Adult Day Healthcare. And also, the Arizona Caregiver Coalition has a new program to help caregivers with adult day health care.
And that is separate from what Area 8
It's separate, but we work together. It takes all of us.
Right. But, you get authorized, some dollars, vouchers or...
That's right.
Yeah,
and you can contact them through us. Call our 24-hour senior helpline. We'll put you in touch with the Caregiver Coalition. And they can authorize up to 96 hours of adult day health care that we were just talking about, where they pay the center directly. You don't have to put the money up and then wait for reimbursement.
Oh, I love that.
It's really good if you want to try it first. They call it a taste of adult daycare. Maybe that's not the model for you. Maybe you're applying for another program, such as Arizona Long-Term Care or something where you need some services for a gap. That would be perfect. And all of our senior helpline professionals can explain that program in depth if you give a call to our helpline.
It's a great segue to what we kind of left off in our second segment, talking about social isolation. And really, one of the things that adult daycare does, it really engages seniors around others. And,
yes.
Scott, you see this way more than I do, but we have so many older adults that are aging in place alone. And, statistically, we know there's about a third of our population right now that is 65 and older that lives alone. And that number is only going to grow. And we know that the marriage rates are down. We know that people aren't taking partners in, that they are living by themselves. And we, as human beings, we crave and we need social interaction. And I've said it here on the show, social isolation is becoming one of the biggest epidemics that we have going on in our society. And they say it's the equivalent of smoking 15 cigarettes a day, causing depression, causing all kinds of causing all kinds of issues health-related wise, physical as well as mental health. So I know that the whole concept of adult daycare and getting people, even if it's 2 days a week.
Yes.
Is,
a sense of
awesome.
belonging. You belong. Someone wants to know why maybe you didn't show up. Someone's looking for you.
Right.
It's a nice feeling. And people really enjoy the adult day health care. Caregivers tell us as well they feel their loved one sleeps better because they've been more active during the day. And even some have felt anecdotally that their loved one is declining slower in cognitive difficulties because of the stimulation that they get at the center.
No, that's really, really important.
It is.
As we get ready to end our third segment here, I want to really talk a little bit about, and it's such a hard subject to talk about, is abuse and adult protective services. I saw Robin Cochran when I walked in. She was walking out, and you've got attorneys like her that are at area agency aging, beck and call for the people here in our community. Can you talk a little bit about what you guys do?
Sure. We know now, and we've probably already know, but now we have the studies to back it up, about social isolation, not only as a comorbidity for health, but social isolation often leads to self-neglect. Self-neglect calls to Adult Protective Services, their number one call, both here in Maricopa County and nationally. The person has their life has become smaller, they've become socially isolated, maybe some depression, due to loss of spouse, unable to drive. Perhaps people who used to visit or engage are also more isolated or unable to participate. That's when self-neglect can come into play. Not necessarily taking good care of yourself, some depression, non-compliance. Those are most of the calls to Adult Protective Services. And we receive referrals from them as well.
You receive referrals from them and you give them to them.
And we make them.
And what's great is that, and I hate to sound like that Lerner and Rowe commercial. One call, that's all.
It's true.
One call to 602-264-4357, or you go out to AAAPHX.org.
Yes, all of our support groups, all of our healthy living classes throughout the community are on there as well.
We're down 3 segments. We got one more to go. Stick around. You've been listening to Health Future. I got Scott Hawthornthwaite here in the studio from Area Agency on Aging. We'll be right back.
Bill Gunderson's Nationwide Best Stocks radio show is now on Money Radio 1510 AM and 105.3 FM. Every morning from 9 to 10 a.m., professional money manager Bill Gunderson will talk about the economy, markets, and the best stocks now. Bill Gunderson is also the inventor of the Best Stocks Now app and the writer of the weekly Best Stocks Now newsletter. If you like to invest in the markets, this is the show for you. You will not want to miss one episode. Visit GundersonCapital.com for more info. That's GundersonCapital.com.
Dad insists on not using his walker and keeps falling.
I don't think Mom's been taking her medication, and I'm concerned.
I can't juggle work, my kids, and look after my parents. It's just too much.
Is your loved one experiencing the effects of Alzheimer's or dementia or other memory impairments? Parkland Memory Care in Chandler is dedicated to providing the highest quality of care for those with Alzheimer's, dementia, and other forms of memory loss, providing exceptional care for your loved ones. Get a private tour and reserve your loved one's place today and get price protection before their grand opening. Parkland Memory Care, where care is their singular focus. Visit parklandmemorycare.com to request information or schedule a tour. You can also get more information by calling Parkland at 480-857-4984. That's 480-857-4984. parklandmemorycare.com.
The Army National Guard is committed to keeping the country safe and our communities secure. Composed of hundreds of thousands of citizen soldiers from all walks of life, the Guard is always ready to respond to local or national emergencies. We protect the homeland. We're always there when called upon, and in every state and territory, we stand guard for our communities. To learn more, log on to NationalGuard.com.
Sponsored by the Arizona Army National Guard. Aired by the Arizona Broadcasters Association and this station.
The next generation of home improvement with everything you need to do, projects smarter. The Home Depot. More saving, more doing.
back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and we're on our fourth segment. And if you're just tuning in, I got Scott Hawthornthwaite from Area Agency on Aging. He's a care coordination director, and we've talked about a lot of great stuff. And if you missed it, catch it up on our website, please, at cypresshomecare.com. Click on the media button. The third button down, once you clicked on the media button, is radio show, and you'll catch our entire program here today, and you'll catch about 200 plus others that we've been bringing to you for the last 5 years. You know, Scott, we have really covered a lot.
We have.
And there's a couple things I just need to get out right now, and then I want to turn it over to you because I want to make sure we don't miss anything. And first and foremost is your phone number. It's that one call, that's all.
That's right.
602-264-4357. If you are listening in and you have a loved one you're caring for, you know of a loved one that could use some assistance, or you are that very person, call that number or go to the website at AAAPHX.org.
That's right. Let us come out into your home at no cost, make a plan, and see what's available to meet you and your loved one's needs.
Exactly. So we talked a little bit about social isolation, and I know along with social isolation comes a lot of other challenges. And, you know, we ended the last segment, and I want to pick up on that, talking about APS and Adult Protective Services. And I know you also have a hoarding program. So I'm going to turn the mic over to you, and I'll take us out of this segment as we end. So
we do. We're unique in the Area Agency on Aging that we have a licensed therapist who specifically works with people who have issues with hoarding. She runs a group called Too Many Treasures. It's for people who, for whatever reason, are assigning some type of emotional value to an inanimate object. Sometimes there's too many pets involved or whatever it may be. These are folks who are not homebound yet. They're able to still come to a group to make some plans to prevent them being a homebound person in a hoarding situation. But self-neglect and self-isolation go hand in hand. There are programs and resources that can help, friendly visitor and friendly phoning programs. You can get some information on that through the Area Agency on Aging. Or the senior centers. Most communities have a senior center that you can either take your loved one there or arrange for transportation. Many have a van or use Dial-A-Ride to have a person come in for a noontime meal. They also do activities on different issues and talks relating to aging. It's a good way to meet some friends and to get out and be a part of the community. There's also many classes offered, if that's for you, on chronic conditions, diabetes self-management, taking care of yourself. A lot of the senior centers are changing to attract the new demographics, and some do exercise classes and field trips. And it's really not the senior center you might think of if you haven't been to one in a while. So I would urge you for that.
And it's interesting, you talk about the new demographic. I mean, baby boomers are now entering it. I mean, the oldest of the baby boomers are 72 now.
Yes. We talk about that a lot at work because a lot of us are baby boomers. And the senior centers and the services are going to have to change. We want more choices. We're not going to settle for 11:30, here's the lunch.
Exactly.
We want to choose when we want it and maybe a few options. And we're starting to see that happening.
And maybe
senior
eating a little healthier.
And healthier as well. That's right. And people want to exercise and to use the internet and things that years ago we didn't see at the senior centers.
I had on the show here about a year and a half ago, I had Cole Marvin. I don't know if you know Cole. He's the executive director for the Friendship Village over there in Tempe. They just went through a $2 million remodel, and they put a sports bar in their place because their residents, which are baby boomers, want a place to watch football games.
That's right.
And eat chicken wings and do all those kind of things.
Yes, you're seeing the new model of senior centers even have like a short order cook with a few options and also some exercise and I think that's a good wave. And that's the kind of center I would want to attend as I'm aging along the way, like all of us. If you're dealing with a person, though, who's a little bit down, has some social isolation, maybe some grief issues, I think it's important to talk with them in a caring, non-judgmental way. Encourage them to attend a service or a class. Maybe you could go with them the first day to the senior center. Try to connect person to support and counseling. We do have a program at the Area Agency on Aging called the Eldervention Program. It's very unique in that we can go to your home. We have licensed therapists who will go out to your home to provide short-term counseling if there's a bereavement issue. Sometimes family caregivers are dealing with a loss or stress over placement. They're specialists in coming out to your home. They can bill your insurance and help you get over the hump, so to speak.
And as we conclude September is Suicide Awareness Month, yes. and we have an epidemic that is happening amongst our older adults.
Yes, and depression is not a normal part of aging.
It is
you
not.
You will hear people say, well, what do you expect? They're 90 years old. That is not a normal part of aging.
Right.
And I think we need to make that clear. So there's a lot that we can do. Please encourage people. There are services out there. Whenever I speak to caregiving groups, invariably people come up to me afterwards to say, I cared for my mother and my mother-in-law alone. I had no idea anything was available. We think everyone knows us because we're busy. We know that they don't. So if you can help us, if you're listening, get the word out. Your friends, neighbors, or yourself, give us a call. If you don't want to have a case manager come out to the home, talk to the professional on the phone and get some ideas.
Well, it's interesting. Even HomeCare, we've been in the business. We're going on our 25th year. People don't even realize this service is available. Right. Exactly like you said. They do it alone. Wow, you would do that?
Yes.
I thought you did nursing. No, we do companion care.
They think they don't qualify.
Yeah,
especially working family caregivers. Remember, on any respite qualifications, the income's on the care receiver, not the working family.
Right.
So we've done that in social services, taught people they don't qualify unless you're indigent. It's not true. We'll work with you. If there's someone with a little bit higher income, we'll cost share it with you.
Love it. Absolutely.
I think that's the future of social services.
Again, 602-264-4357, AAAPHX.org. 2 plugs I want to do. One more time on the Duet 3rd Annual Family Caregiver Symposium. It's on October 18th. It's going to be at the First Christian Church of Phoenix at 6750 North 7th Avenue from 9 a.m. to 1:30 p.m. Some great resources there. And I also want you to reiterate open enrollment.
Yes, open enrollment for Medicare begins October 15th, which means next week you'll start getting a lot of mail about open enrollment. Please find out, make educated decisions about your plans. You can either call and speak to a counselor, you can come into the office, or better yet, meet us at one of our 20 sites all over the county where you can bring your bills and spread out and pick the choice of insurance or other programs that are best for you.
And if you're a family caregiver, don't feel like you have to go at it alone.
That's right. We're talking about you.
We got to say goodbye. Go ASU, right?
That's right. Sun Devils.
Great having you, Scott. Make it a great day. Have a great weekend. And we'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.
One certified financial planner, Nancy Fleming, this and every Wednesday afternoon as she joins me for Financial Review. Nancy and I discuss an array of topics from Social Security, taxes, to what types of obstacles you can and will face in retirement. So join Nancy every Wednesday afternoon at 4:35 for the Financial Review. Want more, Nancy? Be sure to tune in every Saturday morning at 10 a.m. for My Smart Retirement, right here on Money Radio.
Money Radio 1510
and 105.3 FM.
KFNN Mesa Phoenix and K287BX Mesa. No matter what the temperature, it's always cool to be in total charge of your finances. Money Radio will tell you how. Take a look at the market. Dow up 12 points at 26,452. S&P down a fraction at 2913 as it settles. And NASDAQ up a point at 8043.
When people want to talk about money, this is the place they come to. And there's more on the way after this break for the latest news. And we begin